there, my name's Alicia. I'm going to be the nurse taking care of you today. I have some orders to perform trach care on you. Is this a good time to do that? Okay. It's going to take me about 10 to 15 minutes, and then after that, I'll let you go about your day. Can you first verify your name and date of birth? Got Pat Snow, 12/16/60. Very good. Okay, Pat. Well, I'm first going to just listen to you, assess your respiratory status, and then after that, I'll get everything set up to do the trach care, and we'll get you all done. I'm going to note that I have good lighting. I have the operator at the head of the bed, and I have suction and oxygen readily available. Okay, Pat, you're going to, I'm going to move your gown down so I can listen to you. Okay, Pat, I do hear some wheezes, so I am going to suction you. Is that okay with you? Okay, so I'm going to go ahead and turn my oxygen all the way up to 15 and make sure that the bag is inflated on the ambu. And I will turn the suction on to regular and just ensure that it's between the 80 and 120, and it is. So I'm going to perform some hand hygiene. So Pat, I'm going to pre-oxygenate you. That way you can tolerate this suctioning. Just let me know if there's any discomfort at any time. So at this time, I'm going to pop off this, place this, and oxygenate my client for 30 seconds. Okay, the 30 seconds is up. And then I'm going to open up my suction and just make sure I can hear that it's working, and it is. And then I will advance the catheter down until I make resistance or the patient coughs. So I'm going to make resistance, and then I'm going to suction out no more than 10 seconds. And then I'm going to note that I can see this little black dot. That just indicates that the catheter is not in the patient's airway. And then I'm going to turn off the suction so the client doesn't accidentally suction themselves. At this time, I'll go ahead and I will note if I removed any secretions. I'll note the color consistency and if there's any abnormal findings. And then I'm going to remove her dressing. And I'll look at the dressing and note, again, any drainage, any color, abnormal findings, and place that in the patient's chart. I will look at the patient's stoma, make sure that there's no redness, irritation, or swelling. And right now it looks like it's good. And I'll also look at the ties, make sure that they're clean and intact, and that I can fit about 2 fingers snugly between them, and Miss Pat's ties look nice and good, not too tight. So I'm going to go ahead and do hand hygiene again. And I'm going to open up my trach kit, and I will do hand hygiene. I'm going to pour about 1 inch of water into the clean side of the basin. And then I'm going to remove my sterile gloves and set them to the side. And I'm going to grab my dressing, or my drape, that'll go on my patient, and I'll grab it from the edges. Okay, so now at this time, I have placed the dressing. I'm going to perform hand hygiene one more time. And then I will don my sterile gloves. And sometimes it takes a minute to get them out. Okay, so now that I've donned my sterile gloves, I'm just going to note that this is going to be my dominant hand, the one that I'm going to keep sterile. This will be my clean hand. But until then, I'm still sterile, so I'm going to remove this inner container, it says here. I'm going to go ahead and just set up my tray the way that I want it and get rid of any of the supplies that I don't need. I'm going to place two 4x4s in the wet basin area, and I'll have two 4x4s and the new dressing in the dry basin. So now I have my sterile hand, and this is going to be my clean hand, and I'm going to pour about an inch of water in here. Okay. So now I'm going to pre-oxygenate my client. Okay, Pat, I'm going to place this on, and I'm going to have you, or actually I'm just going to have you take 5 to 6 deep breaths for me. Okay, very good. And I'm going to remove this, and then remove the cannula. I'm going to come over here, and I'm going to submerge it in the water and take my sterile hand and clean the cannula. And then I'm going to put it into my sterile hand and then pour the sterile water over it. And I'm going to grab the top again. And then reattach. How are you doing, Pat? You still feel okay? Very good. Okay, so now I have cleaned the cannula, and again, I'm just assessing her respiratory status, making sure that she's not going into any distress. I'm going to take my sterile hand, and I'm going to clean the top and underneath. And this is a good time to look at the stoma to make sure that there's no redness, irritation, swelling. And then I'm going to clean on the top. Underneath. And then I'm going to pat it dry. And I'm going to grab my perforated dressing, and I'm going to place it underneath. And again, there's no need to replace the ties because the ties were clean, there's nothing soiled, and they were the right tightness. Okay, so now I have the new dressing placed. I've performed all my trach care. So at this time, I'm going to remove my sterile gloves, and I will perform hand hygiene. So I'm going to, again, just check her respiratory status, see if she's in any distress, make sure that she sounds fine. I'm going to note the size and the type of trach, and note any abnormal findings such as like swelling or any discolored mucus that we suctioned. And then I will end by just taking care, cleaning up my area, making sure Miss Pat tolerated it well, and I'll note that in my chart that she tolerated the procedure well, she tolerated the suctioning well, and then I will clean up my area and make sure that she has the call-eye in place and that she doesn't need anything before I leave the room. And I will come back and assess her in a little bit.